Africa cannot develop nor have peace when the citizens do not enjoy good health. The outbreak of this coronavirus, COVID-19 pandemic, and its rapid spread calls for a concerted effort on the part of all African governments in finding a cure to this dreaded disease. As the United Nations puts it, peace is not the absence of war, but I say the presence of a pandemic like this coronavirus is tantamount to the absence of peace. As part of our contribution towards the fight against this COVID-19, we, the Ambassadors for Reconciliation, Justice and Peace, have shot a movie titled Preventing Coronavirus from Spreading. We are in the process of shooting another one, a 60-minute movie titled Coronavirus Championing African Excellence. This movie highlights the urgency for all African governments to pull resources together in funding scientific research into plant medicine and to promote African herbal medicine practice on the African continent and beyond.
We, Ambassadors for Reconciliation, Justice and Peace, Africa, are fully convinced that the cure for COVID-19 lies in African herbal medicine.
Visionary leader, the African president of the 20th century, was Surgical Dr. Kwame Nkrumah, on the eve of Ghana's independence, gave one of the most inspirational speeches known in Africa and the world. In his speech, he made a profound statement, and I quote, "Our independence is meaningless unless it is linked up with the total liberation of the African continent." He continues, "The black man is capable of managing his own affairs." Another president of Ghana, a man of peace and a man of reconciliation, John Ajekun Kufuor, on the occasion of the celebration of Ghana's 50th independence anniversary, chose a remarkable theme, and I quote, "Championing African Excellence." These two definite statements focus our minds on the forward-looking ambition of the African continent, which is to advance towards achieving worldwide, world-class standard of excellence. But the greatest gift Africa ever received was that from His Holiness Benedict XVI's post-synodal apostolic exhortation, Africae Munus, which translates from Latin as Africans' commitment in the service to reconciliation, justice and peace. The objective of this Africae Munus is to address the particular needs of the church in Africa. And what is Africans' commitment? Africa is committed to championing African excellence, especially in developing the African herbal medicine industry towards the fight against global pandemics, lessons from COVID-19 experience, and recommendations for leadership in Africa as follows.
Deadly infectious disease of unknown etiology, earlier referred to as Wuhan pneumonia, was reported in the Wuhan city of the People's Republic of China in December 2019. On January 7, 2020, it was confirmed as a new type of coronavirus called Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. In February 2020, the World Health Organization, WHO, named the pneumonia as Coronavirus Disease 2019, COVID-19. The sudden and rapid unexpected spread of COVID-19 from China to several other countries compelled the World Health Organization to officially declare the disease a global pandemic on March 11, 2020. By April 29, 2020, a total of 1,671 cases of SARS-CoV-2 infections had been confirmed in Ghana and over 3,100,000 cases across the globe.
The reported cases continue to rise because of the rapid spread of SARS-CoV-2 via human-to-human transmission. As at 7th August 2020, the total confirmed cases and deaths in Ghana stands at 40,533 and 206 respectively, while over 19 million confirmed cases and 722,000 deaths are reported worldwide. Currently, no approved specific antiviral drugs or vaccine are available for treatment or prevention of COVID-19. The general case management, treatment and prevention plans globally involved supportive care, hygienic practices, lifestyle modification, and healthy diet.
Response from tertiary institutions, universities or research institutes on finding effective treatment or cure and vaccine for prevention of COVID-19 is largely from non-African countries. The present clinical protocol for COVID-19 treatment in Ghana are solely authorized and are yet to fully incorporate African or Ghanaian herbal medicine regimen. It is expected that in the wake of COVID-19 pandemic, mandatory institutions such as the research institutions across Ghana and other African countries would team up to develop a consented framework and suitable natural product remedies towards integration of the African Ghanaian herbal medicines into both current and future therapeutic options for the management and treatment for COVID-19.
In Ghana, we have Center for Plant Medicine, Alternative and Traditional Medicine Directorate, Food and Drugs Authority, Federation and Traditional Medicine, and Medicinal Plants and Natural Products Discovery Experts.
Africa in general, and Ghana in particular, is endowed with an array of accomplished and experienced researchers in medicinal plants and natural herbal products across universities and research institutions. In addition, the continent is rich in diversity of medicinal plants and a large group of herbal folks and practitioners.
It is time for African researchers, herbal medical practitioners, regulators, other relevant scientists, the private sector and the policy makers to come on board to valorize medicinal plant research and plant resource in order to find local solutions with global impact for treatment of COVID-19 in Africa.
Political leaders and governmental agencies should be included in this search so they can help in the research. The funding should come from government and NGOs. There should be a tax relief policy to local and multinational companies to facilitate mandatory contribution to funding research into herbal medicine.
Medical doctors, researchers, and others in the health sector should be taxing other medicines in the search for a cure to combat COVID-19.
The COVID-19 pandemic has exposed an uncomfortable truth. So many people around the world simply cannot clean their hands, but we can help reduce the spread by promoting hygiene practices as part of a package of action that saves lives. It starts by making sure everyone, everywhere, has access to basic hand hygiene facilities with soap and clean water or alcohol-based hand sanitizers in homes, schools, and healthcare facilities.
It is our hope, the ray of hope, that all African governments will put their resources together to collaborate with the Africa herbal medical practitioners like Reverend Father Ansem Adodo of Nigeria, a Benedictine monk, Professor Samuel Ato Duncan of Ghana, and Professor Maurice Iwo, Professor of Pharmacognosy of the University of Nsukka, Nigeria.
Professor Maurice Iwo, one of the African scientists and scholars of the highest eminence, and according to him, African continent is endowed with an enormous wealth of plant resources, with over 50,000 distinct species in the sub-region of Sahara alone. More than 25% of known species have been used for several centuries in the traditional African medicine for the prevention and treatment of diseases. But what happens to Africa in the global natural product market? Africa still remains a minor player in the global natural product market, largely due to lack of practical information. Do you know the reason for this? The reason is not far-fetched. Just like most of our natural resources, we the Africans have failed woefully to explore our floral diversity to the benefit of the African continent. But there is ray of hope for Africa. The time is now for African government to invest in natural product research and drug discovery to promote the development of the African herbal medicine industry.
Professor Maurice Iwo, a scholar of the highest eminence, is the Chief Executive Officer of the Bioresources Institute of Nigeria. He has been visiting scholar to the Dyson Perrins Laboratory, University of Oxford, 1980. Fulbright Senior Scholar Award, Ohio State University, and the Department of Chemistry.
Personally, I know Professor Maurice Manuakulam Iwo, and he is capable of delivering substance. I have had an interview with him for Dominicos Revista in my capacity as the editor-in-chief. That was the magazine that shook the unshakables, the unmovables, the untouchable, the unbreakable for positive change and effective peaceful coexistence in Nigeria. In the document of Africae Munis, meaning Africans' commitment in service to reconciliation, justice and peace, His Holiness Benedict XVI speaks about grave pandemics such as malaria, cholera, tuberculosis, HIV and AIDS, which continue to ravage Africa in spite of the constant struggle on the part of medical science and the need to bring these pandemics to an end. In view of this, all governments in Africa need to improve commitment to funding scientific, academic, intellectual research and to promote development of the local industry and to facilitate scientific evaluation of indigenous herbal remedies for efficacy and safety. Our next movie after this, Coronavirus Championing African Excellence, is titled Campaign Against Election Violence.